I'm Nancy Jordan. I'm an FNP student at Fresno Pacific University. I have been working with end-stage heart failure patients for the last 8 years and with LVAD patients for the last 2. My scholarly project is entitled A Patient and Caregiver's Perspective on the Quality of Life After LVAD. There is approximately 5.1 million Americans diagnosed with heart failure. Most patients' life expectancy is about 5 years after being diagnosed. Until recently, the only treatment was heart transplant. In recent years, the number of heart transplants annually has stayed about the same at about 26,000. There are approximately 4,000 patients on the heart transplant list currently. Left ventricular assist devices have offered patients hope for a longer life, but the intervention is expensive and can come with many risks. Some of the risks include bleeding, stroke, hemorrhage, or infection. Many clinicians question if the device is worth the risk and for the quality of life. Recent studies have showed that LVAD can improve the quality of life in as little as 3 months post-implant. More studies have shown that elderly patients, and patients with poor health conditions can also benefit from the LVAD device with having few to no complications. Other studies have shown that community hospitals with experienced clinicians can achieve similar results with transplant hospitals. This is exciting news. LVAD therapy is in its infancy stage, and most studies evaluate patients' quality of life versus caregivers' quality of life. This study hopes to incorporate both perspectives of the patient and the caregiver on the patient's quality of life. The Kansas City Cardiomyopathy Questionnaire, the Patient Health Questionnaire, and a short form 12 health study survey will be utilized to examine both groups' viewpoints about the patient's quality of life. Using a quantitative approach to evaluate the patient and the caregiver's response will help to determine if the two views align. Patients will be enrolled in a shared care clinic at Fresno Heart and Surgical Hospital. Fresno Heart and Surgical Hospital partnered with UCSF LVAD Center to help care for patients with LVADs in the Central Valley. Our community-based hospital began our program about 2 years ago. Currently, there are 10 patients enrolled in the clinic. Fresno Heart and Surgical Hospital is located in the San Joaquin Valley. Recently, in 2012, studies have shown that as many as 48% of residents in one of the counties in San Joaquin Valley was diagnosed with heart failure. With this high population in the San Joaquin Valley, Fresno Heart and Surgical Hospital believed that there was something we should do. Offering advanced heart failure treatment seemed the logical approach. These patients can be implanted, treated here at Fresno Heart and Surgical Hospital. They are seen routinely and for urgent needs. The hope of this research is to provide insight on the patient's quality of life with an LVAD. This knowledge will be used to educate community clinicians, potential LVAD patients, and their families. Community clinicians need this knowledge to better serve other patients with end-stage heart failure. Potential LVAD patients and families need to understand the risk along with the potential benefits of the device. The study is relative to meet the needs for our community. Thank you so much.